Why, hello. Welcome back to Your Body Isn't Lying, the series where we stop normalizing women's suffering and start paying attention to our bodies. I'm Latrice Mason, women's health nurse practitioner, clinic owner, and here we talk about all the things that your doctor rushed through, your friends whispered about, and your body has been trying to tell you all along. If you have ever been embarrassed to talk about itching, burning, odor, discharge, or pain with intimacy, this episode is for you, girl. Because vaginal symptoms are not gross. They are not a personal failure, and they are definitely not something that you can just live with. So your vagina is like an ecosystem. It's influenced by hormones, by sex, by soap, by antibiotics, by birth control, by life. So when something changes, it's communicating with you. Here's what I see all the time. Recurrent yeast infections that actually aren't yeast infections. Burning that's not an infection at all. Odor that comes and goes with your cycle. Pain with penetration that women think is just part of sex. And dryness that starts in your early 30s or 40s. Did you know that women are being told that this is normal? They're being told, use this cream. This just happens after kids. Try more lube. The thing is, persistent vaginal symptoms actually point to hormonal shifts, recurrent or resistant infections, inflammatory or dermatological changes, pelvic floor dysfunction, or change in your vaginal biome. We have to stop thinking everything is BV, or everything is a yeast infection, or everything is an STD. And sometimes not everything is fixed with a one-size-fits-all antibiotic. Your comfort is your healthcare, and if something feels off, you really need to speak up. Your vagina is not supposed to go through life just burning. The thing is, I want women to feel like they don't have to be ashamed of their anatomy. You don't have to whisper about your discomfort, and you certainly do not have to accept that intimacy is painful. You have to think about your vagina as it being just as important as your heart and your lungs and your brain. It's just as important. So here's how to advocate. Number one, be specific. Instead of it feels weird, say this: I have burning at the vaginal opening. I have pain with penetration. This discharge is different from my normal. This keeps coming back. Number two, ask what is being ruled out. Are we testing beyond yeast infection and BV? Could this be hormonal? What are the plans if this keeps happening? Number three, I want you to track your patterns. You want to note changes around your cycle, around sex, around new products, around stress, and around postpartum or perimenopause. You deserve solutions, not temporary times of relief. Your body isn't lying. You've just been taught not to listen. So if this episode made you feel less alone, subscribe and share with the woman who feels the same way. You are not broken. Your body is communicating. You deserve to be heard. See you next time right here on Your Body Isn't Lying. Hope this helps.